to Module 8.
We can start with Chelsea, then we'll go around the room and we'll come back to the discussion later.
Sure. So my name is Chelsea Gregg. I currently am a principal research and development engineer and a technical lead for one of our kind of flagship products at Medtronic Neurovascular, which is located right on the UCI campus. And I've been here for about 3 years. And kind of what led me here, or kind of talking a little bit about how I got here. So I did a PhD in biomedical engineering at Cornell University with minors in applied physics and biology. And I knew quite early that I didn't want to do a traditional academic career path. And Cornell actually had a program very similar to this that was called the BEST program, Broadening Experiences in Scientific Training, that was funded by the NIH. So Cornell was one of the kind of first schools to get that initial funding to be able to provide these sorts of programs. And it actually was incredibly valuable to me on figuring out what it is I wanted to do and helping me shape and providing opportunities in order to do that. It also didn't take me very long when I would speak with my PI or some of my other professors that I worked closely with, that they were not very great at advising me on how to do a non-academic career path, because it's not what they chose. They knew how to do that. They knew what you needed to do to become a professor. They did not tell me anything that was correct or didn't know what to tell me if I wanted to not do that. So, I had to look for resources in other ways, and luckily my BEST program was something that did that. And I participated a lot in their science policy work. So I started a science policy organization when I was at Cornell called Advancing Science and Policy. We were kind of a haven for PhDs, postdocs, and faculty members who wanted to find ways to connect more on science policy, whether it be kind of local, state, or national levels. And so I did a lot of work in there, and I really loved a lot of that work. And it also helped me develop a lot of skill sets that I've been able to translate into the work that I do now. And, I like that work so much that I decided I wanted to kind of merge, knowing I wanted to go into industry. I kind of came to that decision because I wasn't totally prepared to kind of leave the bench, so to speak, from a scientific perspective. But I knew I didn't want to be in academia, and I was very interested in making medical technology. So, but I also enjoyed policy and knew that I had a bit of a black box in terms of how to go into that world. So I actually took a regulatory policy fellowship at the FDA as a postdoc. So it's a unique kind of postdoctoral program sponsored through the American Institute for Medical and Biological Engineering. And they're called AIMBE Scholars. And I was placed in the Center for Devices and Radiological Health in the Office of Device Evaluation. And so I sat at the office level working on regulatory policy initiatives of the FDA. And I did that for about 9 months. And then I came to Medtronic here in Irvine, where I've been for the past 3 years. And so I think you'll probably start to hone in on some common themes, but if we're going to talk about translational skill sets, regardless of the exact job or exact career you want to do, I think you've been hearing a lot around networking, developing relationships, ability to influence, all of those things, like whether you're working in a job that's directly related to policy, or you're working in a job that's maybe less so, all of those things are very important. So what policy gave me more than anything were communication skills and ability to influence. And I use those daily because, some of the speakers before talked about you're going to have to talk to people who aren't a scientist or an engineer, don't have a technical background, and you need to communicate what you need to communicate in a very quick way that's understandable and kind of tractable for them. I also have to do that because I work with a lot of non-engineers or scientists in industry. My general manager here at Medtronic, she is not an engineer. And our VPs across the company are not all technically trained, and I have to communicate with them just as effectively as you would with anyone else. And I have to be able to influence them on what our business strategy should be based on what the technology is telling us to do. So that's kind of where I've really been able to learn a lot and leverage a lot from my kind of policy experiences as a graduate student to then now go into industry. And because of that, I think that's helped me a lot to be able to now lead new product development projects where I'm communicating very regularly to the broader business on what I advise we should do, based on what the data is telling us, but, communicate that in effective ways that is understandable to the broader business.
All right, thank you, Chelsea. That's really interesting to hear.